The disease that steals the breath of coal miners is back with a vengeance.
Across Appalachia, I met dozens of other miners with this advanced black lung disease and started reporting their stories.
Basic black lung diagnoses doubled in the last decade. Advanced disease quadrupled since the 1980s in Virginia, West Virginia, and Kentucky.
1 in 5 working coal miners in Appalachia could have diseased lungs. That's true for the thousands who've been tested, and it could be the rate for the rest. The more I reported, the more it became clear it was worse than anyone realized. Go see Brandon Crum in Kentucky, I was told. He's a radiologist whose clinic is overwhelmed with cases of advanced black lung disease known as progressive massive fibrosis, or PMF.
So if I show you for comparison, this is a normal x-ray. And you can see all the dark area, that's the lung, because it's filled with air. And you contrast that to this one. You see all these big wide areas all the way through here. That's all conglomerate fibrotic mass, or PMF. The biggest concern at that time for me was seeing young men my age, and I'm 43 or younger than I am, with the most severe form of the disease, which is the complicated black lung disease.
Crum was so concerned he took his findings to researchers at the National Institute for Occupational Safety and Health, or NIOSH.
So what happened 2 years ago in terms of you sitting down with people from NIOSH?
Well, when I told them, we were seeing, or I was seeing, a lot of complicated black lung disease, and what was most concerning is I was seeing it in individuals in their 30s and 40s. I think there was some hesitancy on their part. I'm not sure they believed me.
He told us that he was seeing a lot of really advanced disease, and it was concerning to him. And I guess my initial thought was, that's probably not true.
The researchers had been tracking black lung disease themselves for decades, but they only tested working miners, not those out of work, and hadn't detected the sharp rise in deadly PMF that Brandon Crum was finding.
He invited us to show us some of the medical images from his patients, and we sat there for an entire day, one after another, looking at these chest x-rays, the worst I've ever seen.
What was your reaction to what you saw?
Horror, shock. I don't know how many other words to use. I was really taken aback, not only that these cases were legitimate, but just how severe they were. It indicated that we had a huge problem, and we realized immediately that it wasn't going to be isolated to a single clinic.
Researchers at NIOSH had only reported 99 cases of PMF in the previous 5 years. But out-of-work miners had been flooding clinics, and in calls and visits to 16 clinics across Appalachia, FRONTLINE and NPR identified close to 2,000 cases in the same time frame.